So my objectives for today are pretty simple. I want to tell you who we are and how we do our work. Because one of the things that I often get asked is, people don't understand how we do our work. And the prime goal we have is to provide quality service to people looking for help, services, or programs. And how we do that is through the work that we do, and I'm going to explain that a little bit, and I'm going to share my screen in a second. The other thing is that I want to talk to you about the data we collect and what we can share with you, because we have lots of data we collect as we take the calls. And in the closing, I'll ask you how you can help us. And the other thing is, of course, I'm very happy to have all kinds of questions. So now I'm just going to share my screen. Can you see my screen now?
Sure can.
Okay, let me just see if I can move it. I can't. So I'm going to be looking off to the right a little bit. I apologize. The other thing I just want to say is that I'm just hopefully getting over a really nasty summer cold. So I may be sipping on some ginger ale as we go through because my throat's a little dry. So, but I didn't want to miss today. So because it's such a great group of people, and I'm so happy to be here. So you can see that there are a number of 211 or 1-1 numbers, and 2-1 is one of them. And let me just explain right at the beginning why, as Carolyn stole one of my lines, is spreading the word. About a year and a half ago, we did a survey across Ontario about 211 numbers, or not 2-1, about 1-1 numbers. And we asked people, what was 911? What was 411, what was 311, what was 211. And 311 is about 5 cities in Ontario, including Ottawa, Toronto, others. That's how they call to get help from their municipalities. 98% of the people knew what 911 was, because a lot of it was in the major cities. The 311 came out at about 50%, and 211 came out at 12%. And the biggest problem is that since 211 was started, there's never been the money to really do a province-wide awareness campaign. There's been money to get us up and do the work that we do. So it's really important to get the word out about what we do, because I think you'll see when I talk about how we do our work and so on, that we are, in fact, a great resource for people. And I can tell you just by the by that we're working with all the Ontario health teams now, because they have to have navigation for health, and they realize they're going to get other questions. And we're hoping to be partnering with all the OHTs in the province through Ontario Health, that 211 will be connected into that, so that they can refer people that call to say 811 now, which is the non-urgent healthcare line, and they can refer them to us to answer their other questions that 811 won't be able to handle. So it's free. It's the most comprehensive database of community social health and related government services, and I'll explain that in a second. And it's everywhere now with money during COVID from the federal government. There is now 211 is everywhere in Canada. It's live. That's the key thing. You're going to talk to a live person 24 hours a day, 7 days a week. And we can do it in 150 languages. I always scratched my head when I first started in this job 6 years ago. How do you do that? But using a service called Language Line, we can get somebody on the line and they explain if they can tell us what language they want. Then we contact our Language Line folks, and within about 2 minutes, we have somebody connected up that can speak that language, and then we have a 3-way conversation. And then standards driven. This is the part that I want to talk about, because this is what is the fundamental basis for our quality control. And that is that there is a service called, an organization called the Association of Information Referral Systems, which does accreditation like a hospital accreditation, or accreditations that other folks may have in different social services parts of the world as well. So I'm not expecting you to read this slide. And by the way, Caroline has this PowerPoint, and she will circulate it to all of you after, so you don't need to necessarily be taking notes. You'll have this, but there are 28 standards that we must meet to maintain our accreditation. and we have to report annually, and we are accredited every 5 years. It is very rigorous, including a site visit, going and looking at our database to make sure that it's up to date, checking in on as a sort of a secret shopper, calling our 211 to talk to the community navigators that are answering the calls, plus a whole bunch of documentation we must provide. So it's I got in the job and was told 3 months later we had our accreditation. So it was being like dropped in the deep end of the pool and figuring out everything. So it really is very important. And I'll give you a couple of examples as we go through about the standards that we need to maintain. So there's our public inquiry, the online directories, and callers' needs. Those are the 3 areas I'm going to cover in terms of how we do our work. So people can call us, they can chat, they can email, they can text. Last year, we handled 260,000 calls across the province. We had about 34,000 calls, contacts, I should say not calls, contacts, chat, email, text, and mostly the highest percentage being actual calls. The thing that we get, the message we get probably every day from people is they really appreciate being able to talk to a live person in English or in French. And as a matter of fact, we provide the French language service for the whole province here out of our office here in Ottawa. As it says here, it's answered by professionally trained specialists who assess needs and refer to the most appropriate services. So I'm going to talk about the community navigators who answer the calls. First of all, you will appreciate this in the work that all of you do, is that our level of pay is very low. It's something I've been trying to work on, but it's very difficult because we have not had any increase in funding from the Ontario government in 10 years. But our staff have to be perfectly bilingual in French and in English. And before they actually get to do a live call, we train them for 6 weeks intensively about the work, and they're trained to conduct an assessment of inquirers' problems and needs. And then I'll get to the rest of those in a minute. And they also have a great deal of training, including ASSIST and the others that are listed here. ASSIST being how to deal with a high distress call where somebody may be saying they're contemplating suicide. We're not counselors, so we need to know how to talk to that person to get connected to the distress center or to the appropriate agency to help them. So that's what happens in terms of that. So extensive training. And this particular slide really just sets out how it works. Somebody calls, bonjour, how can I help you today? And then we start asking questions. And one of the things when we're looking for hiring community navigators, we're looking for people that are empathetic, calm, and curious, because people need to ask questions, and they can't be overly intrusive. But I'll give you just a little example. A person calls us, and they say they have a problem paying their hydro bill. So then you start just asking questions. Well, are there any other issues related to that? Well, yeah, I'm not going to have any food left before my next check comes in. And yeah, I'm behind in my rent, so I have problems with my landlord. So out of that call, we make 3 referrals, one to, say, the LEAP program with hydro, one to the nearest food bank, and one to perhaps a legal aid clinic. And that happens often, that there are multiple referrals. And a lot of times people that call, they think they have problem A, but when you start probing and asking questions, it ends up that it's actually something slightly different or completely different that they really need help with. So I can tell you that out of our calls, about 79% are actual, they are referrals, where we actually talk to them and refer them to something. 15% are those calls, people saying, look, can I have a particular phone number? Can you tell me what the address of a particular agency is? But 79% are referrals where we do an assessment and then make the referral. Now, the other thing that's really key about that people sometimes don't realize is we do advocacy as well. And I'll explain what I mean by that. When somebody calls, once our people have had experience, and we do this in the training as well, to assess the situation. And if a person is pretty clear, yes, this is what they're looking for, we can say, here's a number that you can call for that service, or here's where that service is, and that will be it. But there are a lot of calls where people seem to be a little bit hesitant, not quite certain. So what we'll say in that situation is, can we call you back in 24 hours to see how you've done? And if they give us consent, then we will call them back, and we will and we will then check to see if they got through to the service they needed, or the help that they needed. Pardon me. And then we will then we will say, okay, great. But if they haven't, then we will work with them again. The third situation is where the person, you can tell they're really, maybe shy, just not confident about this. We will actually, if the agency that we want to refer them to is during their hours, we will then call the agency and do a warm transfer. We will explain to the agency, once we get to the right person, what the issue is, who the person is, and then we'll turn them over to that person. So there's sort of those three levels that we do. We want to make sure that the person can resolve their issue, ensure that the caller understands the next steps. And then we also track, as we're doing this, if we cannot meet the need or find the service that's an unmet need, then we track that as well. And I'm going to talk to you a bit more about that when I get into the information that's available. So the chat is there, email inquiries, and the database resources. I'm going to talk about that a bit more, but I'm going to talk about the data curators. So those are the two groups of people we have, is the community navigators. And then before I leave the community navigators, one of the standards we have is that we will answer every call within 80 seconds, 85% of the time. I can tell you during COVID, we couldn't keep that standard because the calls were coming fast and furious. In the data side, and this is really key to talking to all of you today, is that 85% of our 7,700 records that we have here in Eastern Ontario must be updated annually or more frequently than that, but a minimum annually. So we have folks on staff who are data curators, resource specialists, and what they do is they are responsible to keep that database up to date. So they do several different things. We contact all organizations, as I said here, at least annually. And how we do that is we send out an email, and we have so many emails per month because we can't. We spread the 7,700 records over 12 months. And then we send one email and say, could you please update your records? And I was making a presentation in Pembroke a number of months ago, actually just before COVID started. And somebody said, it's such a pain to have to update our record. And fortunately, somebody else from another agency, it was a group of agencies I was presenting to, said, why are you complaining? If we want this information in the database so the referral can be made to our agency, so it's in our interest to update the record. We try to make it as easy as possible. If somebody is having difficulty, it says right in the email, call us, and they can actually talk through the changes if there are any. But it's pretty important, as you can appreciate, that the database, as I say, is the engine of everything that we do, and it has to be a very smooth running engine so that when we give out information, it's accurate. If you've changed the location of the service, or the phone number's changed, or you've added a new program, or you've dropped the program, it's really important for us to know that so that we can make the correct referral. We also look at social media and news, if there's changes and additions to services. And that's the other thing I was going to say. If there is a new agency or new service that a community group has put together and you're chatting with them, ask them, have you got your service in the database of 211? And if not, just tell them to get in touch with us. So they can do that just even by just calling 211 and then get referred to one of our data specialists here to get you set up with a record of the service and program that you have. And we do custom data sets for local needs. For example, one of the things that we do is here in Ottawa, there's a thing called Connecting Ottawa, which is a service for people with immigration legal problems. So it's their website, their page, but all the data that's coming is being fed by us. We've done the same thing in Kingston with the Canadian Frailty Network, where they don't want to maintain a database. And this is something that many people call me about. And that is, a lot of people, even during COVID, got money to maybe develop databases. I was talking with the Ottawa Community Foundation, for example, and they've given money for databases, and they never seem to work really well. And when people call me and say, well, we're going to set up a database, what we do is I asked them a question when they called me. I said, what is your funding for maintaining the database? And they say to me, what do you mean? And I said, well, once you build it, the biggest problem is keeping it up to date, because the minute you set it up and it's live, something's going to be out of date. So that's the business we're in social service programs, health, community services. We have, I can say with confidence, the most up-to-date database of these resources in the province and in Eastern Ontario. So when I talked about this, so this is what the data folks do. We don't do any commercial stuff. It is all we just, other than in some cases we have pharmacies because we've been requested by a particular organization to have pharmacies included in their database. But the other thing I wanted to mention, for both the community navigators and the data curators, they have to be certified within 12 months of starting work here.
I hit a mute button.
And so we, so that they have to write an exam, and they have to sort of study for it first, and then they recertify every 2 years. So that goes back to the whole issue of quality. So the other thing I wanted to talk about, you saw earlier 211ontario.ca. This is a screenshot of our own portal, 211easternontario.ca, which I suggest to you is probably the best place to go to. And you'll see the different icons here, that all the different areas that you can look at. And so the other thing is, what's really interesting is you can do it, search by either located near or serving. So it actually has a thing 5, 10, 20 kilometers away from the, when you hit the button on located near, then you can narrow it right down to what you're looking for. This is we use an API for this, so it's and this is obviously updated constantly with any changes that take place. So here's just again, you can do a topic search or keyword search, food banks. Food is not just food banks, but free local home delivered meals, all types of school meal programs, and so on. And then I just wanted to use an example locally. This is a record of an agency, the Agape Center. So it shows what it does, the description, the application process, and then it shows the next page shows contact information, the address, and the different topics that are available there. And so so that just gives an example of what a record looks like. That's the public side. We also have in every record sort of background information that the community navigator can see in case there's some particular messages the organization wants that we need to know about in terms of dealing with people when they call for that, or we're looking at providing that particular information to a caller. Now, one of the things the other thing was on my list is that if you're going and see something and you don't, it doesn't make sense, then you can suggest, if it's your own, you can edit the listing. It's sent to us. It doesn't automatically get updated because we have to check the way our system works. It's the same all across Ontario. So we have you saw the exclusion and inclusion rules on the slide with the data curators. It has to be exactly the same everywhere because we have to be able to be exactly the same for everybody else. So people are going to the website. So it gets edited. If you have changes, then it goes to one of our team which Kathleen leads, and they just check it over. And then within 24 hours, it gets updated into the database. Now, the other thing I wanted to talk about is the data we collect. We capture the needs of callers as well as the needs that remain unmet after calling 211. So we capture some demographic information, and you can see here that 37%, for example, are 38 to 54 years of age. And then the income is already shows here, 10% are Ontario Works, for example, and we can share this data with you. So just to give you an example, in Cornwall, Stormont, Dundas, Glengarry, Akwesasne, we had 798 calls, reports in 2022. This is from the 1st of January of 2022 to December 31st, 22. Total needs selected were 1,091. And you can see that we're down a bit as COVID has gone down. The numbers have gone down slightly. The thing when you see the difference between the 798 and the total needs, that is where there have been multiple referrals. And that's why that happens. Then if I go to the, again, you see gender, age, language, type of inquiries generally, information referral, this one case was 78%. So sorry, I made referrals, some were information only, some were administrative database calls, somebody calling us about updating their record, for example. And then when I go to the next slide, I can show you all of Ontario. We had, as I said, 265,000 calls needs, but 256,000 calls. And then in Stormont, Dundas, Glengarry, here's where you see the breakdown. And we show that the bulk of the calls came from Cornwall, but it's broken down into the other subsets of SDG as well. And the previous year, the different needs, the calls, you can see the calls that were, as we indicated, were less than the previous year. That's another problem, is people just not knowing about us, and that's, I think, would go up very substantially if once we rob a bank somewhere and do a really great awareness campaign across the province. And then there's different categories. So I saw, for example, just trying to find it here. Food. When they had the breakdown on the previous list, that number of that was 58 calls. And then you can just see that breakdown. And we can drill down several levels into that, to those different categories you saw in food banks, or was it, meal delivery or whatever it might have been. So we can go down about 4 levels to give you more information. So this is just a screenshot, so I can't do that on the screen, but that's the information that we collect. And again, this is just the same stats from across the province. And now the unmet needs identified. So what we do is we had a total of 63 unmet needs, and you can see that one of the 31 was no resource found. 16 are ineligible. But this is the thing where if you're a particular agency and you want to know about some of this information, I'll give you an example. There's an after call report that every community navigator does after every call, saying what was the need and was it met and so on. But then when unmet needs, they will then say what the reason is. And they usually put a little, a couple of points about why. And I'll give you an example that happened where I got a call from United Way in Prince Edward Hastings. That's our western limit for the area that we cover. And they had an unmet need, and they asked for a little more information. We go and look at it because we have to do this manually. Go and look, and we said, well, the reason there was two calls because they couldn't get transportation, and the people were in Bancroft, and which is in North Hastings, and they needed transportation to go to their doctor. Well, a volunteer transportation was available to take people from Bancroft to Belleville, but these people's appointment was in Peterborough, and they weren't set up to do that. So we were able to tell them that, and as a result, they changed their system so they could take people to Peterborough, because Peterborough is almost as to Bancroft to Belleville, about similar distance, and that depending where the service was available. So we were able to share that information with them to help them address a problem. Just a simple example of how we can be helpful in that regard. And then across the province, there were almost 6,600 unmet needs. And then the other thing I just want to touch upon is Caroline, is that we also provide a service to municipalities when there are disasters. And this is of particular interest to mid-size and smaller municipalities. So what happens is we have a very simple protocol. We have this with Cornwall. We have it with Champlain. We have it with the nation, and we have it with there's about 15 municipalities we have this arrangement with, and we're in the midst of getting more. And what it simply is a very one-page protocol that if they have a disaster, they can call us at 3 o'clock in the morning and say, look, we've got floods. We need to let people know where the sandbags are, where they can get water, where they can get a hot meal or shower. And then what they do is on their Facebook page, their Twitter account, on their message on their phone. So if you need to get information about support because of the floods, call 211. And we create an emergency record. And then what we do is we have a designated person in the municipality, designated person on my team, who will exchange information as much as required every 4 hours, every 12 hours, so that we can update that information to let people know. What it allows municipality to do is that they do not need to be answering the calls. They can be working on the disaster. And it means that they can be really focused on the things they need to be focused on, and we can be helpful to them. It does not cost anything. And it's something that has worked very well in the floods in 2019. And for example, Clarence Rockland and Alfred Plantagenet, they activated so that we could handle the calls when people wanted to know where the supports they needed, where they could get them. So just something else that we do that people aren't generally aware of. And these are just some events within the 211 system where we're involved in disasters. And not only was there flooding in Prescott Russell in Ottawa, but also in the Bracebridge Huntsville area at that time. So just wrapping up, and I know maybe I've gone too fast, Carolyn, but I'm ready to talk and have questions. As you can tell, I've done this presentation once or twice, but these are the kind of calls we get. As we said, hydro, mental health won't surprise you, or having challenges with family situations. We get a simple call. What's the telephone? What's the telephone number for the library? Always, when I first started, somebody said, "Do you know the most interesting call we got?" And I said, "No." They said, "Well, somebody called and asked, what's the number for 211?" So anyway, I don't think that's true, but that's what I was told when I started. Dental assistance for seniors. This is one that more and more, in COVID in particular, but even before COVID, seniors that are alone, that don't have any kind of network, we get calls. And there's organizations, for example, there's one organization here in Ottawa called the Friendly Voice, where we can connect people up and they'll start calling them every day to keep people connected and to get them engaged. And legal papers, so legal aid, mental health. So that is the thing. And as I said, I've done this maybe so often that I go too quickly, Carolyn, but that is what we do. And I think what would be most helpful when I make these is the questions, is to have people ask questions and so I can clarify anything. And but I just want to say that how you can help is make sure, if you're an agency, that your information is up to date. If you're talking to somebody and there's a new service a community group has put together, ask them, are you in the system? And then finally, as Carolyn said at the beginning, tell the world about 211, because I can say I came from a completely different world. I ran the Canadian Bar Association, the lawyers group, for 20 years. Got approached about this after I left there and said, I'd be interested in this job. I didn't even know what 211 was. And then I read about it when they sent me the information. Said, look, we're helping people every day. And this is I get up in the morning now and know that we're going to be helping people every day. It's the best job you could have, and have a great team of people who are grossly underpaid, but are very dedicated to the cause. So I'll stop there, Carolyn, and happy to answer questions.
Sure, John. If you want to unshare your screen, then we can see.
Yes, I do want to do that. Let me just pull that up. Come on.
There is one question in the chat, and I think I answered it for you. But
now I'm having trouble here. Let me get out of this. Stop sharing. There it is. There we go.
Great.
Okay.
So there was a question in the chat about data collection, and I presume you do this for all regions. So there was a question about collecting the same kind of data in Prescott Russell, and I believe that's a yes, correct?
Yes, absolutely. Yeah.
Perfect. And I before I go to the other questions, sort of your last comments that you were making about, how important it is to tell folks about what 211 is when we were doing our work to create the Vibrant Community Plan, which is really addressing the needs of our community. We spoke to 1,200 individuals one summer and asking them what they believe our community needs. And when we pulled all that data together, 80% of what we were told was needed already existed in our community. So I think what you'll all agree with is that we're often very minimally funded to run our programs, which gives us maybe just enough money to run the program, but no money to promote it, or very limited funds. And so we're doing Facebook free stuff, very limited. And so we need a really good resource to be able to connect people to the right resources that exist now in our community. But also what we love is that we receive the quarterly data from John about what isn't, what needs are still unmet, what clients are not being able to access. So then that can help us in our work, in all of our organizations, and hopefully developing all the programs that our community needs. So I will stop there. And I see Mel has a question.
Melanie.
Hi, John. Okay, so thank you for this presentation. Again, I'm just repeating what Carrie's saying, so important. So I also wanted to let everybody know that John has forwarded us some social media bundles. So I think that if you're looking to spread the word, I'm sure he can do that again to anybody who wants to email him about that. We also follow them on social media. I believe you guys are 211 Eastern Ontario on social media on Facebook. So at 211 Eastern Ontario. And anytime we do any promo for them, we like always tag them. So, and we always get a little thank you back. I don't know who does your Facebook, but we always thank you for sharing. There's also 211 Ontario, which is, I think, kind of covers the whole Facebook world. I think 211 Ontario has an Instagram, but 211 Eastern Ontario, I don't know if you do.
No, we don't have an Instagram yet. Just wish I had more physical human resources to do all this stuff, but we're a small team.
So yeah, so if you're looking to help in any way, like that would be like the best way to do it. Either share 211 Eastern Ontario posts or ask John for a social media bundle. And then there's tons of imagery that you could use to help promote it. And also, we did a little bit of a campaign amongst, I don't remember what committee it was, Carrie, but for 211 Day. Yeah. When's 211 Day?
February 11th.
February 11th.
Second month, 11th day.
So 1 week leading to 211 Day, we had all of our like community partners post about 211. And I feel like everybody in this group like totally do the same thing. That's when we really try to push 211. So I just know these are little things that I've done with the Social Development Council to help promote 211, and I thought I'd just put it out there.
Thank you, Melanie. Can I also say to folks, if you want hard copy material, I have a room right beside my office here full of stuff. I have French and English, what I call a tear card where it describes the service, but you can tear off the bottom part and it fits right into your wallet with the number. I have fridge magnets. I have all kinds of stuff. And we'll ship it to you at no cost to you. If you want that, you can just email me at the email address that was jonh@CNEO-NCO. And you're going to get that slide deck. It's on the last slide. So you can get the email address there. And be very happy to, to send that whatever you need. You just give me the amounts that you'd like and we can ship them to you. So happy to do that at any time.
I think what I love the most for your hard copy stuff is it's like just a small little card that it looks like, I don't know, maybe like an inch and a half anyways, and it's something that we've usually requested to include in any events that we're having, that we're doing, like goodie bags, like our senior fair, our job fair, whatnot. If there's things going out to folks, John will send that express post if I'm last minute requesting it, and we can get it out to hundreds
I deliver
of people.
it to Pearl Leader myself, Carolyn.
So if you have things coming up where you are going to be giving out goodie bags or sharing information, having the 211 information there, and that'll be shipped to you at no cost.
And the other thing I was just going to say is that when we did the food hampers, we did put a piece of information in the food hampers as well, so that people could hear about 211.
Exactly. There is something in the chat here, John. I just checked our organization's profile and it is outdated. Who do I contact to get it updated?
Okay, why don't I make it easy? Just send an email to me, to John H at CNEO-NCEO.ca, and I will pass it on to Kathleen, who is my data coordinator. She's on vacation this week, but we'll have somebody on that at the beginning of next week. So I don't know who was asking the question, but because I didn't open the chat. I
just put your email in the chat. I also
I saw that.
I just checked ours, and there is, if you go on 211 Eastern Ontario I think it was CA, and if you search yours, there is somewhere at the bottom recommend an update.
Yeah, there is.
There, you can do that as well.
You can do it that way too, but if you want to make it easier, I can just have somebody contact Kathleen or one of the other two people that do the data work will get in touch with you at the beginning of next week.
Are there any
I
other
guess the other thing.
Oh, sorry, go ahead.
No. Is there another question?
No, I was just asking if there were. So how about you?
I was going to just share a couple of brief anecdotes about the range of work that we do. I was doing a presentation to a bunch of staff at the Canadian Mental Health here in Ottawa about 2 months ago. And they didn't realize, when we go do soup to nuts, and I'll just give you sort of 3 examples of the range of things. At one point, several years ago, we had a call from a gentleman in a rural setting who called, and I happened to be here. It was about 6:30 in the evening, and I could hear down the hall Marika, one of our community navigators, having a long conversation. And she came to my door and said, "This gentleman wants to know about the governance of 211. How are you a not-for-profit?" And she, of course, didn't know that. So I said, "Well, put the gentleman through to me." And it was funny because we got chatting, and he said, "I'm over 65." And I said, "Well, so am I." And we kind of laughed. And then he said, "Look, I on a pension, a limited pension. I have a little house in the country. I've had a very bad knee problem. I just come back from my doctor, and my doctor has said that I must have my knee replaced, but I need somebody to care for me for 3 weeks after the operation." He said, "I don't have any money to pay for that, so I don't think I'm going to be able to have the operation." So I chatted and I said, "Look, I'm going to put you back to Marika because she can look, see what the services are." I said, "Here's my cell number if you don't get a solution." And then he'll put him back to Marika, and she was able to find a program that he was to get in touch with. I never did hear back from him. So that's one kind of situation you get. The other one, the one that I really was really upsetting in a way, was 2 of the situations, actually. One where Lynn, one of our community navigators, got a call, and it was a woman, and she said, this was before the bus station closed in Ottawa, so it was about 3 years ago. And the woman said, I've just arrived from Toronto to escape a physically abusive situation. And then Lynn could hear a baby crying. So she said, "Have you got a young infant with you?" And the woman said, "Yes, I have triplets, a year and a half old." And so Lynn said, "Well, just hold on a second." And we have, of course, we have people that we call, and we got, I think it was the Salvation Army, we have several agencies we can call. And they said, "Look, we can have somebody there in 20 minutes. So we stayed on the phone, and then the woman got there from the Salvation Army. We spoke with her, and they took this woman and her 3 children. But interesting enough, about 2 months later, I was making a present to the social services group, sort of updating them at the city of Ottawa, and doing a presentation similar to the one today. And I told that story, and the person out their hand, "Yeah." And that afternoon, we got a call asking for an extra crib from the Salvation Army because they didn't have one. And we went to Walmart and bought the crib and took it over to the Salvation Army. So the system does work, and so that's one of. And then the other one is when everybody is comfortable with different kinds of communication. We got involved in a chat, and it was a young woman who I suspect was maybe 16, who was hiding in the children's section of a public library, chatting with us about the fact that she'd run away from home. She ended up with a pimp, and she wanted to escape from it, but he threatened he was going to kill her and her family. She didn't know what to do, so we just the chat and so on. We were able to convince her that we could send somebody from Children's Aid to the library, and also somebody from the police. And they went, and this matter was looked after. But so that's the kind of range of things that we do. I can tell you right now, and this will be no surprise to any of you, more and more now we're having unmet needs. I think we all realize that with COVID, and when the money stopped, the extra money from COVID, everybody said, I know the Ontario Volunteers said, keep the money going for at least another year, but they haven't. So we're calling, especially on shelter issues, homelessness or being evicted. You're dealing with rent evictions in Cornwall, finding places for people to go, and it's harder and harder to do so. Finally, it looks like maybe there's going to be some reaction by government about housing issues, but problem is you can't snap your fingers and have places built tomorrow. So it's a real challenge. So, and that's one of the things, if you ask me what my big issue is two of them. One is making sure the mental health of my team, because when they're not here to make big money, so they really are determined to find somebody a solution. And when they can't, It really, yeah, it's a bummer. And the other thing is, of course, retaining staff, because we train them pretty well. And once they find that out, they, then they get an offered job from the federal government for $10,000 more a year. Can't argue when the person takes that job. So anyway, those are my two challenges, just to cry in my beer for a minute here.
I think those are challenges I think all of us are also similarly having, right, in terms of retention with staff and ensuring that our staff who are going above and beyond for vulnerable people in our community are paid properly. But this sector, unfortunately, we're all chronically underpaid. So and unfortunately our work gives us, warm and fuzzy butterflies, but that doesn't pay rent and mortgage. So keeps us going for long enough, but it's, I'm sure, a reality everybody else is facing. So thanks for sharing that, because I think we're all in the same boat.
Yeah, I know exactly. So I said we all have that same problem. And, my staff come to me when they get that offer of that job with more money. And actually, Marika was one of the people I mentioned. She left us about a year ago. She said, John, I'm a single individual, and it's hard to make ends meet with being paid $38,000 a year, which is what we pay. And so, she said, I got a job for 10,000 more. And I congratulated her. No point in getting upset about it. I said, yeah, you got to do what you got to do. But it makes it really hard. And we weren't on the front lines like a nurse or somebody in a hospital or other agencies during COVID, but the calls we were getting were pretty tough. And, these people, deserve a lot more. And I keep kidding with my staff that I'll fix it all if I win the Lotto Max. And I saw last week that there was 55 million was in Ottawa, and I had a ticket. And I went to look at the ticket. Oh, shucks, it didn't work. So anyway, that's not a good business plan in any event.
No. But I think a lot of us are probably having the same business plan.
Yeah.
So does anybody else have questions or comments before we close off for the day? And don't worry about taking less time than the hour, John. I don't think we've had any that take a full hour, which people are appreciative of, because we all have a lot going on, but we save the hour, just in case there's a lot of questions. But for the most part, these are lasting 30 to 40 minutes. Yes, go ahead, John.
Can I just one final comment? I appreciate people that one of the things that I talked about from the beginning is we really focus on doing quality work. We have a complaint system. If you hear something or somebody did not get dealt with properly, I want to know about it. We don't use this to, beat up on our staff. We use it as a learning coaching experience. But if we don't get that feedback, we can't get better or address something maybe where there's a gap. So don't be shy if you hear somebody that has had not a good experience. Based on that, we don't get a lot of complaints, but just want you to know we're quite open to that and any constructive criticism, because you can't get better unless you're open to that. So I ask people, and finally, just tell the world about 211. I'll just tell you one final story, Carolyn. I tell all my friends about 211, and I play golf with some guys. I have breakfast with a group of friends that worked in the association world, and I said, don't forget about 211. And one of my colleagues, a former colleague, said, John, will you stop with this about 211? And I said, okay. He called me 2 months later, and he said, John, I'm calling to tell you were right. He said, I was out at the end of my driveway, and I have an elderly couple next door, and they were chatting to me and saying, look, they can't figure out this issue they have. And he says, call 211. The next day they came out and they said, Claude, we got our answer by calling 211. So he said, John, I'm a convert. So that's why I just share that story with you, because that's what we can do to let people know about it, because you never know. You may never use it yourself, but there's going to be a neighbor, a relative, somebody who could use 211. And a final story, the way I illustrate why it's so difficult, it's such a maze, is I was doing just before COVID on CGOH, I was doing a morning program talking about actually Toy Mountain, but I was also taught because we register for Toy Mountain. And I'm just going to do one other thing. The other thing we did during COVID, and Caroline, I just want to mention this so people know for the future, is when the hampers were being done, there was an issue about people that didn't have the internet that couldn't register. So we set up so that Carolyn tell people call 211. We filled out the form and then we passed it on to Carolyn. So we do that kind of work as well. I just forgot to mention that we can help out in those situations. But so I was on the show and we had the screen and I was able to tell them, I said, okay, let's ask how many social, government, and health services exist within 2 kilometers of the Byward Market. And I had the host push the button, 812. So I just did that to illustrate that for anybody, I don't care how sophisticated or unsophisticated, the system is difficult to navigate. And rather than trying to, oh no, wrong number, call this number. No, call this number. Call us, and to the very best of our ability, we'll connect the person to the right place that can help them. So I just end off with that, Carolyn.
And
so much for my advertising.
I know you mentioned, we may never use it ourselves. However, you as a caseworker helping a client that may have a question can call as well. I have, there was I can't remember what it was now, but maybe a year or so ago, I called 211 because there was a community issue and I just couldn't figure it out. And so that you can use it as a part of your tools for the work that you do. And then I will also offer John up. I'm sure he's willing to do a similar presentation like he did this morning to any of your organizations. So if you have a staff of 10, 20, 100, and you want him to come in virtually and present to them, I'm sure John would be more than happy to do that as well.
And you know what? Right in my notes, I forgot, was the first thing I was going to say, and I forgot to do it, is exactly, you can use the service as well. We have many different organizations that call us, and because they're looking, they have the client sitting right with them, and they'll call right now that people are seeing people in person. And the other thing is, by the way, I'm quite happy to do in-person presentations as well. I have 2 colleagues, Julie and Danielle as well, that can make presentations. So if you would like a presentation, we're happy to do that. Because I've just realized that how to get people to know about 2-in-1 is 1 brick at a time. So we just keep building those bricks to get people to know about it. So, and Carolyn, can I just say, I want to thank everybody for taking the time to listen to this today. And I want to thank you, Carolyn, for the opportunity to be in the spotlight.